now. And just as sort of a reminder, since we're recording and we'll be sharing it publicly, we can, as always, answer lots and lots of questions, but we aren't able to talk about any like very specific individual scenarios because of HIPAA. So just remember to keep it like either anonymized or generalized so that we can address your questions. All right, thank you all for being here. Let's see, why is this not going? Hooray, okay, great. So hi everyone, welcome and thank you so much for being here. My name is Kim Cortez and I'm the new unit supervisor for the supported employment team here at HICPUF. And before we dive in, I wanted to take a minute to quickly introduce the other members of the employment team for folks who weren't at the last two meetings. So many of you already know Katie, of course. She is our team lead and is the main point of contact for most technical assistance questions that you might have for us. You may also know Andre Johnson. He is overseeing our provider training and reimbursements process. Jenny Jordan will be co-presenting with me. She is leading our efforts to develop the new services we're talking about today. And then if you're familiar with our incentive-based pilot program, Lauren Riley is leading that project. And that's our team. So we always like to start by grounding ourselves in our mission, which is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. So it's some of you I recognize have been at a few of these meetings, and it's really been a pleasure hosting these so far and getting your feedback on and just input on the new employment services that we're developing. Jenny's going to talk about this more in a minute, but all of these services are a result of Senate Bill 21039, which is a bill that came together thanks to the advocacy efforts of our stakeholder community. During the last two meetings, we've shared sort of how we've been thinking about the design of these new services and collected lots of input from attendees about what sounded on track, where there were questions, where you see the greatest needs. So today our goal is to share with you what we plan to move forward with proposing to the Centers for Medicaid and Medicare Services, or CMS. And our hope is that today we can collect sort of any final thoughts and input that you have and sort of share what you can expect as we move forward from here. So before I go over our agenda for today, we're going to be utilizing polls again in this meeting. So if you're in the last meeting, not as many polls as last time, but we had a great time with all of our polls. So to kick things off and sort of just get everybody used to this feature, we have a quick poll to get a sense of who's here today and what perspectives you all represent. So can I get it? Yeah, okay. So this question is just asking how you would identify yourself, and you can select all that apply. So if maybe you are someone who receives services and you're an advocate, or you are a employment consultant and also a family member or whatever, you can choose sort of as many as apply. And we're going to let this run for a minute, and while you all are answering, I'll hop over to our agenda. So really quickly, here's what you can expect from our meeting today. I have one more slide to talk about housekeeping. Then Jenny is going to recap what led to these services and then walk us through the first of our new services, which is benefits planning. After that, we'll have some time for discussion about that service. Then I'll take over from there to talk about workplace assistance. And then again, we'll have some time for discussion, and then we'll wrap up with sort of where we go from here. We're at 88% participation. That's not so bad, pals. Good job. So I'm going to leave it running while I do housekeeping, and then I'm going to end it. Okay, so we're all pretty used to the virtual environment, but I want to remind everyone to please stay muted unless you're presenting or asking a question. If we notice that you're not muted and there's background noise, we just want to warn you that a member of our team might mute you just to make sure everyone can still hear. Feel free to use the chat to ask questions and provide comments or feedback sort of throughout the presentation. Jenny and I will be trading off answering questions in the chat. Some of them we may also hold to just address verbally as part of the overall discussion. If you would like to ask a question verbally, please use the raise your hand feature so that we can keep track of who's waiting. if you click on the reactions at the bottom of your screen, there's an option there to raise your hand, and that will help us keep track of who's waiting to speak. And before I turn it over to Jenny, I want to thank you all again for being here. I'm going to end our poll so we can see what we got going on here. Here's our little share results preview. Hopefully everybody can see that. Ooh, lots of other professionals this time. We didn't have as many of that group last time. We've got advocates, benefits counselors, employment consultants, managers, providers. So yeah, cool. Thank you all for being here. All right. Again, I just want to say I appreciate you all taking the time. I know this has been a number of meetings and it's a Thursday afternoon and we all have a million things going on, but it's really valuable to us to have you all here. So with that, I'm going to pass it off to Jenny.
Awesome. Well, good afternoon, everyone. My name is Jenny Jordan. As Kim mentioned, I'm a member of the supported employment team at Healthcare Policy and Financing, or HCPA. I am thrilled to be leading the rollout of these new benefits. And to echo what Kim said, we are so grateful to all of you who have shared feedback previously. It has helped us to refine the service and will hopefully make it so that those services are clear, understandable, and of high benefit to the people that we serve. We continue to welcome your thoughts as we clarify the services and get ready for that federal review and implementation. We will pause for questions after providing information about each service. So let's start with some high-level background information. Next slide, please. So as you may know, Colorado is an employment-first state. The basic premise of employment first is all people can work and should have the opportunity to work if they wish. Some people may need more support than others. The services we are proposing are designed to help people who may need some extra support or encouragement to pursue work. In June of 2021, the legislature passed Senate Bill 21039, which championed the end of subminimum wage practices in Colorado. The legislation specifically tasked HCPA to add services that would address line-of-sight supervision and ongoing benefits counseling. The legislature set a deadline of 2023. Both of these new services will be added to the Supported Living Services, SLS, and the Developmental Disability, DD, waivers beginning July 1st of 2023. Next slide. As Kim shared, we will be starting with benefits planning. So next slide, we'll just jump right in. The purpose of benefits planning is to assist members, their family, and support networks to understand how benefits may be affected by employment. It is an individualized look at options available to that member so that they can make an informed choice. Benefits could include supplemental security income, SSI, Social Security Disability Insurance, SSDI, Medicaid, Medicare, food stamps, housing assistance, and other federal, state, local benefits. We know that it is common for people to have fears about losing their benefits and not understanding how they could work and keep their benefits. We want to help dispel that myth and arm people with accurate information. Next slide. So who can access benefits planning? We are excited that benefits planning will be available to any members enrolled in the Developmental Disability, or DD waiver, as well as the Supported Living Services, or SLS waiver. They don't have to be actively seeking employment to access the benefit. Though we are hopeful that after having a better understanding of how their benefits may be impacted by work, that they might be more inclined to explore work as an option. It can also be leveraged by those members who have a job and perhaps are deciding whether to accept a promotion or an offer for more hours or wages. Next slide. So does benefits planning sound like something someone you know would benefit from that? We hope so. Are you thinking that the person may not want to wait till July for this kind of support? Great news. The Division of Vocational Rehabilitation, or DVR, can cover benefits counseling now. If that person has an open case or their case was closed successfully, DVR may be able to cover benefits counseling for that person. Benefits counseling is a parallel service to what we are proposing for benefits planning. So it is worth a phone call or email to their DVR counselor to see what may be possible. DVR is working very hard to ensure that their counselors are aware of this impactful service, and they're trying to spread the word amongst the people that they serve. As mentioned earlier, benefits planning through the waivers will be available to people who do not have a job and may not be seeking employment. They can access it at any time, and that's represented by the large green half circle. We anticipate that this benefit is posed to serve a large portion of the adult intellectual and developmental disability, or IDD, population who are not working yet. As previously mentioned, we hope that this could be a natural gateway to robust conversations about employment. Benefits planning is also a service available to members who are employed. If a member is connected to DVR, then they can access benefits counseling through DVR, as reflected by the middle blue half circle. That said, if DVR's response is that they cannot add benefits counseling for that person at that time, or their projected timeline does not meet the member's needs, then waiver funds can be utilized, and that's what the small purple half circle reflects. Next slide. And Kim, just as an aside, I can't remember if you had turned on the closed captioning or not. So if you haven't yet, if we could get that on, it'll help with the slides going to the website. Thanks. All right, now for proposed provider qualifications. Benefits planners must have one of the following certifications. The first two listed are through the Virginia Commonwealth University, the Community Work Incentives Coordinator, or Community Partner Work Incentives Coordinator. And the third on the list is offered through Cornell University, the Credentialed Work Incentives Practitioner. To obtain these certifications, you must go through a rigorous training program and then demonstrate competency. The content is a deep dive into Social Security, disability benefits, Medicaid, Medicare, and other public benefits. Our proposed qualifications are consistent with the current DVR vendor requirements. Benefits planners will also be expected to be knowledgeable about Colorado's Medicaid waiver system, including the practical elements like eligibility or the buy-in options. We also want benefits planners to have an understanding about how home and community-based services may be providing a foundation that that member is using to build their desired life. Benefits planners should keep a pulse on federal, state, and local level resources so that they can help members access and sustain those benefits when necessary. Next slide. So what activities fall under benefits planning? Well, benefits verification and benefits summary analysis would be available to members. Benefits planners could assist with developing a work incentive plan or help with evaluating job offers or promotional opportunities that relate to their benefits. Because benefits planners will be knowledgeable about Colorado's waiver benefits, as well as Social Security, and have a pulse on local programs, the benefits planner should be able to identify programs that might support the member and explain what would be needed to obtain and maintain those benefits. Next slide. If benefits planners identify resources that could potentially help members, they can assist with making referrals, including referrals to DVR. The benefits planner is expected to have solid communication skills that can be able to and should be able to coordinate with the member's team to ensure that the member has the necessary support to enroll in that desired program or tap into that resource. I'm sure it's no surprise to all of you that our system is complex and there are members with unique situations. The benefits planners can be leveraged to navigate those tricky situations, with the goal being that the member can maintain necessary benefits and continue to work. As you may know, reporting income to Social Security needs to occur regularly. And most programs require documentations that demonstrate that the need for continued eligibility. The benefits planner may assist the team in identifying what documentation may be needed and may make suggestions for how to collect and maintain the documents. The benefits planner may assist directly with the collection and the submission of documentation on like a temporary basis if others are not available or able to. This may be particularly needed if the member is attempting to access the benefit for the first time. The team should work to identify what sort of support system that the member may need for that ongoing document maintenance. Next slide. Now for some logistics. Providers delivering benefits planning can either be an agency or an individual. Through either avenue, they must be a Medicaid approved provider and have the necessary certifications. For this service, we're thinking it doesn't really make sense for it to be delivered by the member's legally responsible person. So it'd be like a spouse, the legal guardian, or family members. If you have reasoning as to why we should consider allowing these folks to provide the service, please do let us know. As Medicaid approved providers, qualifications will be verified upon initial enrollment and through the revalidation process. Again, demonstrating that staff have the necessary certifications will be a key element of this. Existing program approved service agencies would need to add this specialty to their application to deliver this service. And as a reminder, benefits planning does not exist yet, so you won't be able to add it at this time. We will keep you informed as updates are made to the necessary systems. Review of this service will be included in surveys completed by the Colorado Department of Public Health and Environment, or CDPHE, and individual providers will need to follow the process for initial enrollment and revalidation. Next slide. We envision that benefits planning could be delivered in person or virtually when standard telehealth protocols are being followed. While we don't have specific rates yet, we anticipate that the service will be billed in 15-minute increments. And finally, as a reminder, when the member is connected with DVR, they should inquire whether DVR can cover benefits counseling. If the member needs help answering benefits-related questions, and that's prior to when DVR may be able to provide it, then the waiver can be used to fund benefits planning. This would likely be in situations where the member is being offered more hours or a wage increase, and getting benefits planning support is urgent. If the team can demonstrate that they attempted DVR and they believe that DVR's response is insufficient to meet that member's needs, then units for benefits planning can be authorized and utilized. Next slide. So this concludes the benefits planning portion of our presentation. We want to pause for questions and feedback. So what questions do you have? Is there anything that we are missing, or do you have concerns? Providers, are there areas that you anticipate needing support to successfully deliver this service? You can share thoughts or questions in the chat or Q&A. You can raise your hand and unmute. And we have about 20 minutes allotted for questions and discussions for this service. So we welcome kind of your thoughts now.
Great. Jenny, I see Maria has a hand up, and then there's one question in the chat. So go ahead, Maria.
Hi, thank you. This is Maria Stepanian from CPWD. Appreciate all this information. And I just wanted to see if you can clarify. You talked about the qualifications of the person providing the service as well as provider agency, but just to help me understand, does the provider agency have to be PASA or not?
Great question. So we're trying to find a balance with that. So if that agency is a PASA, a program approved service agency, then yes, they could add that as a specialty, kind of expand that benefit to the area. The other option would be, like, let's say that you are a qualified benefits planner, you're a CWIP or whatnot. You could kind of become a Medicaid provider as a single individual and could be delivering the service in that model. If you wanted to expand to have employees, then you might need to shift to the PASA model. But that's kind of what we're envisioning, is trying to give some flexibility, knowing that not everybody is currently a PASA that might have this certification. And Katie, Kim, if you have other thoughts or things to add to that, or if I explain that in a weird way, please chime in. Did that address your question, Maria?
It does, and I think if there is room for feedback or suggestion, I would share that our organization is a Center for Independent Living. There are 9 centers for independent living in Colorado. Most of them do have certified benefits counselors already on staff. In our organization, we have 2 certified benefits counselors, fully certified, and both are bilingual. One ASL fluent, the other Spanish English fluent, and I would love to be able to utilize their capacity and expertise to assist people through this legislation, and people with IDD that might not be through DVR or might not seek employment. But I would love to be able to do that without becoming a PASA. We provide other services for Medicaid, like nursing home transitions. And if there are other avenues for agencies like Centers for Independent Living that do have employees providing this service, to be able to apply to become a provider through Medicaid for this service without becoming a full-blown PASA, I would highly recommend and suggest the department to look into it. Thank you.
Yeah, I'll just chime in real quick to say that's super helpful feedback. I think what we had in mind was, or what we had been focusing on was, what about individual benefits planners that are sort of like their own business, right? But hadn't considered benefits planners that might be employed by another organization or agency. And so we'll definitely look into if there's a mechanism to allow someone who's approved Medicaid provider or an individual who might be employed by a larger organization or agency. So we'll definitely see if we can incorporate that.
And if you don't mind, Maria, if you could put some of your contact information in the chat, I'm very curious to know what other mechanisms you guys have for billing Medicaid, and that might be a path for us, or give us some clues on how we might be able to make those arrangements. So thank you so much.
Thank you.
All right, so I see a question from Lee. Could an agency that is rep payee for an individual deliver benefits counseling? We are envisioning, yes, we're not going to be putting parameters on that. Their role as rep payee might be different than when they have like their benefits counselor hat on, and they might be doing that more in-depth like analysis, where the rep payee duties might be more kind of the regular, excuse me, documentation collection. So there might just have to be a distinction between when they're wearing that hat, if you will. Kim, do you have anything to add for that one?
Yeah, I would just say, this is obvious probably, but like subject to all the same requirements, right? So that like, just because you're a rep payee doesn't mean that you would be eligible to provide the service. You would still need to like have someone on staff that has the right qualifications and be set up as a PASA, which you presumably would be. And then, and I would also just add it wouldn't necessarily need to be the same person. Like if we're talking at the agency level, an agency could provide rep payee services and also have sort of like a separate benefits planner on staff that then is able to bill for this service.
Great. And then I see a question from Karen. Can people with state SLS funding receive benefits counseling? And Kim, you might have more of an insight onto the why of this, but my impression was that it was not going to be included for them.
Yeah, it was only identified as for, at least at this time, for the SLS and DD waivers. And I believe that's because of how the legislation was drafted / the fiscal note was drafted. I'm not 100% sure that that's the reason. I think that we would be open to exploring like, how do we get this extended to state SLS? But the answer I was given was that the services are not intended to be included in state SLS at this time.
Thank you for raising the question, Karen. I see a note from Rachel. Benefits in Action is a nonprofit cost that has SS certified non-attorney rep on staff, as well as other benefit navigators. We would also like to have a smooth transition to offering this service. Thank you, Rachel. I know we connected after the first stakeholder meeting, and you guys are absolutely still in mind for this. And maybe if we can figure out how to make that a seamless process for people that are agencies outside of being program approved service agencies, we would love for your organization to be included in that as well, or figuring out ways we can partner going forward. So thank you for that. Any other questions? Are we, does it feel clear? Does it feel like you would have what you needed if you wanted to become a provider of this service?
I have a question.
Please.
I'm on the phone. Sorry, I'm on the phone only, I'm driving. As a program approved service agency already, can you guys see if there's an easier way or a quicker way to add this service to your existing agency? Currently, you don't need site visits or any of that. I'm qualified, I have my certificate, I have everything, but it's been over 2 months and it's still just hanging out, waiting for review. So I think that when an agency would like to get on, and it's just a thought, if there could be some type of quicker way to add it to support your individuals.
No, thank you so much for that comment. And I know that provider enrollment process has been a challenge for some folks and feels very timely. We will do what we can to make it as smooth as possible. There will be some elements where we're dealing with kind of other elements, whether that's CDPHE or the systems team at HCPF, and we might be still bound by some of their timelines. What I can say is that our team really wants this service to be successful and for us to get it up and running as close to July 1st as we possibly can. So we'll be working with our internal partners to do as much as we can, and then communicating with you guys as a community in things like, hey, it's available now, go ahead and start adding that specialty within your provider portal. And hopefully we can keep a pulse on those approvals. And I can't promise that we can make it go any faster, but I can tell you that we're committed to try and make it as smooth as we can with what's in our scope.
Wonderful. Thank you so much.
Any other thoughts, concerns? All right, so Stepping Stone has a question in the chat. Does DVR have their own benefits counselor, or will they allow PASAs to bill for the service if they have a qualified benefits counselor? Great question. So part of what we're working on,
if you wanted some help, sorry.
So thank you, Darby. Part of what we're working towards is a sequencing of services with DVR. So if that member is with DVR and is eligible for benefits counseling through DVR, then that provider agency could be a DVR vendor for benefits counseling and could be paid through that avenue. Once that person moves on, and they might have a closed case with DVR, it's been a few years, then that same person might need benefits planning again. And at that point, it could be done through the waiver. And maybe it's that same benefits planner that they're working with, because that agency might have contracts both as a program approved service agency and a DVR vendor. Darby Remley from DVR is with us, and I heard you chime in if you want to add anything to that.
Yeah, absolutely. So we currently have over 30 benefits counselors that are DVR approved vendors that can provide the service. So that are located all around the state, but then a lot due to COVID, a lot of our providers also provide virtual services. And so even if you don't live in the area of the state that they're in, doesn't mean that they can't necessarily be a provider for someone. So APSI does have a benefits counseling guide that comes out. I can get the link and put that in the chat for everyone, and that lists all the benefits counselors in the state, and all the ones listed on that guide are DVR approved vendors. So so the service is definitely out there and available through DVR. It's, yeah, we just gotta, as long as they're connected with DVR and show that interest and talk to those services about their DVR counselors, they should be able to access that.
And just real quick, Darby, I think that this is correct, but in case this was a part of the question, I just want to make sure that I'm not misrepresenting. All of the benefits counselors that DVR is working with, those are separate individuals or agencies that are enrolled as vendors, right? Like, it's not as if someone goes to DVR and they're getting benefits counseling through DVR and it's like an in-house benefits counselor. It's still sort of like an outward facing referral process, right? So
Correct.
then if
those are like contractors for the service, yes.
Right. So in that sense, it functions the same as it would for a PASA under the waiver. So if you are a PASA right now and you have a benefits counselor and you're not set up as a DVR vendor and you're interested in being able to bill DVR for that service, then I think, Darby, correct me if I'm wrong, but the first step would be to get set up as a DVR vendor if you aren't already. And if you are, then I think you can go through the process to get that added as an approved service that you're able to provide.
Correct. Many of our benefits counselors, if they're not just like an independent, a lot of times they are housed under a larger agency, and sometimes that agency provides lots of different services like job placement, job coaching, those kind of things. And so if for some reason they're just now adding a benefits counselor to their agency, it would just be reaching out to our vendor unit. So if you go to the DVR website and you go under the vendors tab, that's where you can access the link to contact our vendor unit. And all they would have to do is provide their certification showing that they are a CWIC or a CPWIC. Those are the two certifications that we do require in order to bill for benefits counseling. And so that just shows that you are a certified benefits counselor through those two training programs that Jenny had talked about, that Cornell or Virginia Commonwealth University. And so, so they would just have to contact our vendor unit, provide a copy of that certification, and then they could have that service added to their vendor profile. Otherwise, if they're a new counselor or a new provider, just reaching out to the vendor unit, they would complete a vendor registration form, a W-9, and we do now require background checks for all of our vendors. So that is a new requirement for all DVR approved vendors. So that is another step that gets added to that. So it's pretty simple, just the registration, the W-9, the background, and then again, submitting that certification. And then when those services are approved or when you're an approved vendor, that would all be listed. So DVR counselors could authorize for those services. Thank you, Katie, for putting that all in there. I appreciate it.
Yes, thank you, Darby, for sharing those insights, and for Katie for adding some links into the chat. Definitely appreciate that. And I think just perhaps to make a plug, if you're currently like a PASA and you're thinking about maybe I should do this, there's funding sources through DVR available now. So you could go ahead and send staff through the training, and then once it's added to the waiver, add that specialty, and then you kind of have those two different potential sources to be funding that position. Let's see. Oh, so Maria says CPWD is one of those agencies that is a vendor for DVR and provides benefits counseling and other employment related services. Yes, thank you, Maria. I think that this might be an area where we do see a lot of overlap between our different employment oriented kind of entities and cross disability opportunities.
Yeah, and I'm wondering, it seems like maybe not, but that if there's a, to Maria's earlier question, like if someone is also set up as a DVR vendor, like is that a requirement that we could roll in as an alternative to being a program approved service agency? I don't know what that would look like, but it seems extra inconsistent to have it set up so that you would need to also become a PASA if you're sort of already set up and providing the service. So yeah, anyway.
Yeah, we'll definitely be taking that back and poking where we can. There might be some limitations that we might not be able to get around, but we'll definitely be looking into it. So Kim, should we just go ahead and turn it over to you for the next segment?
I think so, yeah. If another benefits counseling related question comes to mind, definitely feel free to still drop those in the chat or raise it later if we have time at the end. But want to make sure we have ample time to talk about our workplace assistance service. So I'm gonna hop into that now. Maybe, great. So thank you again for being here and for the input on benefits planning. That was a super helpful discussion. So now we're going to explore workplace assistance, and this is what we're currently calling the benefit that we envision will meet the line of sight service need from the legislation. That said, one of the questions we'll get to is whether or not workplace assistance is the right name for this service, but that's coming at the end. That's just a little preview for everyone. So we've been talking about this in the other meetings, but this service is unique and we're really trailblazing here in terms of expanding the nature and scope of employment related services. So we're so appreciative of the input we've had so far in the stakeholder engagement process and the other ways that you all have sort of been in touch and shared your insights. We've considered a lot of sort of possibilities for this service, and we're honestly getting excited about like how it's shaping up. I think many of you shared in the early experience of feeling like this was a little like definitely needed, but also kind of nebulous. So we've had to make some difficult decisions in terms of like how we move forward that I'll get to, but I think in terms of sort of clarity of the service definition that we've made a lot of progress. So I want to start with the why of workplace assistance. So as I mentioned and Jenny mentioned earlier, within Senate Bill 21039, the specific language of that bill directed HCPF to create a service that would provide for line of sight supervision on the job as a less intensive and less expensive option relative to job coaching. And as we've sort of been talking about, we've been interpreting this a bit more broadly than literally just for people who have line of sight supervision. And the reason for that is that we recognize that if and hope that if we design a service that can meet this need, this sort of specific, somewhat narrow line of sight need, it could also benefit other groups. And as we know, the unfortunate reality is that many of our members, many individuals and their teams believe that employment is not a real option for them because they have more intensive support needs, because they have rights restrictions related to supervision. So the more we can use this to open up the world of employment to people, the better, I think. So with that in mind, who will this service be for? So first and foremost, this service will be for people with intensive supervision needs. And we're sort of in the process of working to align our language and our rules with some of the changes that are occurring related to the settings rule and case management redesign. And that's where this like intensive supervision language comes from. So this includes folks who have line of sight supervision requirements and rights modifications. It could also include members who have court orders relating to supervision, meet risk factor criteria, have limited alone time in the community, sort of anyone who is operating with or subject to more intense supervision requirements. So that group would be eligible to access this service. And then in addition to anyone with those intensive supervision requirements, we're also proposing that workplace assistance be available whenever having a paid caregiver at work for a large portion of the hours someone is working is justified by safety concerns. So this could include intensive behaviors that cause direct harm to themselves or to others. It could also include situations where someone struggles with safety skills or maybe has some poor safety awareness. And again, it's to the extent that it justifies the presence of a paid caregiver. So if you were able to attend either of our previous two meetings, then you know that there's a third group that we were considering for this service. And that was people who only need medical or physical assistance, but do not have intensive supervision needs or safety concerns. So in our last meeting, we shared some concerns that including this group could create some additional challenges with rolling out the service. And that's because personal care services carry additional requirements, including additional licensing requirements, the need to utilize EVV or electronic visit verification. We did lots of polling, and looking at that data, it was pretty clear that while there's agreement that this group is a priority, it was by far the lowest priority among our stakeholders when compared to those with intensive supervision or safety concerns. There was also not a lot of agreement about how large that group might actually be. And sort of as a final consideration, if we do move forward and try to include this group sort of from the jump, we have a lot of concerns that CMS and their concerns around personal care could delay the implementation of workplace assistance entirely, potentially for a year or two. And so as a result of that feedback and those concerns, at this time, we've made the decision not to include people who only need support with personal care or only need physical assistance within the target populations for this service. Because we don't want to risk being able to deliver on this service for the people that we're hearing need it the most, and potentially not have this service ready and able to go live in July. That said, I want to provide a few points of clarification, and I'm sorry, I know I'm talking a lot at you all on one slide. But first, we believe and we hope that many of the folks who you might have considered as falling within this group can be sort of captured by the broader category of safety concerns. So previously we were using language that alluded more to like challenging behaviors, but we've shifted intentionally for a number of reasons to safety concerns. And one of those is that we might be able to catch some of these folks. The second is that personal care can still be provided as part of this service to the people who are eligible based on the other criteria. Because in that instance, any personal care needs can be sort of covered under the secondary and contiguous to the main service criteria. So if someone has line of sight supervision, or if someone has significant safety concerns, and so that sort of puts them under the umbrella of workplace assistance, if they also have some physical assistance needs throughout the day, the workplace assistant could provide that. And then finally, the last thing I want to underscore is that this is intended to just be a starting point. We don't want personal care or other physical assistance needs to be a barrier to employment for anyone. And we are aware that it is a barrier, and we're hearing from you all that it's a priority that we figure out how to address that barrier. And so as part of that, we're collaborating with other teams at HCPF that oversee other services to understand if there are other options to help meet this need. And we haven't necessarily ruled out workplace assistance as a possible solution. We just, at this point in time, want to focus on the other target populations so that we can keep it moving forward and have like a more clear path to approval. And then we can look at, is it the right move to try and add that group to this service? Is there another way to address those needs through other services that we have available? And then move from there without sort of delaying implementation of the service for some folks. So that was a lot of information, especially if you have been sort of following along with us. And maybe even more so, actually, I guess, if you haven't been able to join until now. So to summarize, we're designing the service so that it is targeted to people with either intensive supervision requirements or significant safety concerns. If those folks have other support needs throughout the workday or during the time that a workplace assistant would be present, that staff person can meet those needs, similar to what service delivery might look like for supported community connections. For example, if someone needs some additional assistance, you would provide it sort of secondary to your main service. With that being said, I want to pause here before we move on to sort of the rest of the workplace assistance discussion, both to answer any questions and because I have another poll. I know those of you who loved the polls last time have been waiting. But we're sort of hoping to gauge everyone's reactions to these shifts. And I see that there's some stuff in the chat, so I'm going to launch the poll, check out what's going on in the chat, and then if you have any feedback you'd like to offer verbally at this time or questions, please raise your hand, drop it in the chat, whatever you need. Got to find the right poll question. Okay. So this question. Oh, yeah. Go right ahead.
Sorry.
No, that's perfect.
I am so sorry. There's no way to raise my
I know.
Good stuff. Just to be clear, because of line of sight is mentioned and safety risk and all of that, will there always be then, like there is in SCC, the need to do a rights restriction? Because when you have line of sight, you have to have the rights restriction for the other services?
Yeah, so I think the answer to your question is yes, but flip it around, I guess. We're sort of thinking that anyone who's qualifying for this service on the basis that they have line of sight would already have a rights restriction in place, and that because of that, they would be eligible for this service. And then sort of in addition, we're trying to open it up more broadly than that, so that there are people who could qualify that may not necessarily have a rights restriction per se, but might still need a higher level of support.
Right. So I guess that is my question. Obviously, they need it, but because this is employment versus SCC, et cetera, would it require a separate submission, approval, HRC process to, let's say they do this, and because it's a basically full-time-ish, let's say they get a position, so they're not doing SCC anymore, they've transitioned into this, would they need to process through HRC with a 6-month revisit every 6 months, et cetera, or would it be waived with the job?
I think that I know the answer to your question. And honestly, Jenny might, no, that's okay. Jenny might have a better knowledge base for this one, but I think what we're envisioning is that that review of the rights restrictions sort of as it relates to work would be rolled into the existing HRC review process. So that if someone has a line of sight restriction, let's say it's like in the community, that if there is a review for that related to SCC or day program and workplace assistance and employment, that would sort of be reviewed and evaluated. I'm making a symbol of putting it together with my hand. What's the word that I'm trying to think of? Like collectively, there we go, all together.
Okay.
Does that answer your question?
And if they never, yeah, and if they've never had, let's say they're just coming in to the system, they've never had anything, then it's going to be the same. It's going to be, let's say they've never had SCC or day habilitation or anything like that. They're just new, they're coming in, but due to transition out of the high school, they've found the place, they're getting placed. It will require HRC because of the line of sight type of higher risk thing.
Yeah, if
Correct?
someone is in that boat where that's sort of what the team is identifying, is that they're in that really high risk category and they're going to need line of sight. The one thing, and I don't think this is what you're asking, maybe it is, but I don't think this is what you're asking, but I just want to make sure it's clear for the group. There was a question, someone had a question at a meeting at one time, or a concern that teams, providers, individuals would think that they need to get line of sight supervision or need to sort of subject someone to line of sight supervision in order to access workplace assistance. And so I just want to make sure it's really clear that that is not the case. We're just trying to make sure that people who have those restrictions or may need those restrictions know that the service is available to them, but the service is also available even if the sort of support needs or the supervision needs don't rise to the level of line of sight and a rights modification.
Thank you for that. I appreciate it.
Yeah, of course. Okay, I think I gotta look at the chat, but I think I'm gonna end the poll. No, only 50% of people have participated. I'm gonna leave it open. Also, if you're like, I don't know, who knows about any of this, that's fine. It's counseling, that's good. Okay, great. Maybe I will end the poll because who knows? Maybe you guys are like, we don't know, Kim. How would we know? Ooh, people are participating. The power of verbal peer pressure. Oh, I was gonna read the question. Okay, so if you haven't already responded, the question is, would the shift in focus away from labeling it specifically as sort of line of sight or challenging behavior to addressing safety concerns, including line of sight, do you think that definition will allow the people who need this service to access it? Or are we like, have we like botched the whole thing and now we're missing the mark? We're up to 59% participation. Oh. Okay, I'm gonna end the poll. Share results. All right, this is interesting to me for many reasons. We definitely have a handful of folks who are thinking, I can think of some people that this isn't going to cover or it's missing the mark. So definitely appreciate that feedback, and hopefully there's some reassurance that even if there are folks who aren't going to be captured here, this isn't sort of the end of the line for this conversation. And that we want to continue to look at if we can incorporate this into workplace assistance, and if not, what is the best way to meet those needs. Quite a few people think that this does sort of adequately capture everyone. Some folks, maybe there's a few exceptions, and a big showing for probably depending on how safety concerns is defined. And that's sort of a lot of what we're grappling with, is how do we make the definition of safety concerns broad enough that we don't miss people who would really benefit from this service, without making it so broad that like safety is being used really loosely and in a way that is sort of subjecting people to more staff presence than is really needed. And so it's a tricky line to walk, but hopefully we'll be successful in giving both enough guide rails and enough flexibility in the interpretation of safety to be able to make sure that the people who really need the service can get it. All right, so thank you. Moving on to the rest of our workplace assistance conversation. So just a few more points here about who the service is for, less in the sort of realm of target population and more just nitty-gritty detail, I guess. So this service is only going to be available to support an individual job, so not a group job. The pay for the job that someone is working in must be at or above minimum wage. That's consistent with the requirements to phase out subminimum wage in Colorado and the sort of intention of this service to help with that transition. And then finally, from a service planning perspective, someone could access workplace assistance whether or not they also receive job coaching support. So in other words, if someone is completely independent at work outside of their workplace assistance needs, we're not going to require that they keep job coaching in the plan in order to be eligible or anything wonky like that. And then if someone is receiving job coaching and they also need workplace assistance, which will probably be the majority of cases, just as a reminder, those services, they can both be in the plan, right? But they can't be delivered at the same time. So in other words, we still couldn't have two staff there billing for two different services at the same time. But within a member's sort of shift or within a single day, there could be like an hour of job coaching billed and then additional hours covered by workplace assistance. So the two can be happening in tandem, but not simultaneously. If that makes sense. All right, so what are they gonna do though? Like, what is workplace assistance actually gonna look like? So here we're trying to strike a balance between setting up a service that ends up being like someone just sort of standing there watching, which would be awkward and probably not super fun or fulfilling for either the member or the staff, and not having the workplace assistant be so overly involved and present that it creates an issue where there's not like a clear distinction between workplace assistance and job coaching, or where now they're sort of almost interfering with the person's job experience because they're like all up in their business or whatever. And then all of that at the same time, trying to, based on feedback from our last meeting, allow for some overlap with job coaching, just to make, sort of service planning and delivery a little more flexible and a little more realistic. So with that in mind, what we're envisioning is a service where the paid staff person is present to address safety-related needs, while at the same time working to promote the members' integration into the sort of culture and community of the workplace. So on the safety side, this could look like reinforcing and modeling safety skills, or redirecting, providing reminders to follow workplace protocols related to safety, or even to follow like the norms of that particular workplace. And again, if the member has other identified needs, this person can be meeting those needs to help ensure the member feels integrated and successful at work. So at a higher level, those sort of safety support strategies are what would be addressing the supervision expectations. They might be implementing a behavior plan, those sorts of things, and that sort of high level safety monitoring. And then on the integration side, what we hope to see is the workplace assistant offering support, encouragement, and modeling to sort of help the member become part of the fabric and the community of their workplace. So this could include support with non-job related activities and opportunities that are part of that like underlying culture of a given workplace. So maybe that's sitting with coworkers at lunch, or attending a work event, or taking a coffee break with someone else, or like pretty old school, but navigating some water cooler chat. And how do you sort of enter the chat at the water cooler, and how do you leave at a reasonable time so you're not just standing around at the water cooler all day? The workplace assistant could be, prompting and offering supports to the member. At the same time, they're, this is the part that I think is kind of cool. So maybe this is just me like geeking out, but they're what we like to see is they're modeling and normalizing sort of interacting with the member and what that looks like. So I think we know that for folks with the sort of most intensive support needs tend to be at an even greater risk of being socially excluded, including in the workplace, right? So this kind of modeling could help encourage more interaction with coworkers who might otherwise sort of be hesitant to engage or be afraid of saying something wrong. So that it's then sort of like this ongoing disability etiquette training for the members' coworkers, and hopefully reducing barriers to developing natural supports for that individual. And sort of to that end, the workplace assistant can also help identify and develop key natural supports. And then those natural supports could help allow for the fading of this service over time. So in terms of the sort of nuts and bolts logistics, this would be a one-to-one service taking place primarily at the member's place of employment, either during work hours or before or after work. So an example of support like before or after work that may not totally be at the workplace would be like providing transportation to work or home from work. The service would be billed in 15-minute increments. And then lastly, some of you may be familiar with the concept of coworker supports, which often involves paying stipends to employers. And so at this time, that's not being included as an aspect of the service, but it is something that we're continuing to explore and may propose in the future. There's just a lot more involved in sort of determining like what the pay rate would look like and how that would function. And again, we don't want to like slow the service down, like not letting the perfect be the enemy of the good, right? But we do want to keep exploring what coworker supports could look like and how we could potentially implement that in Colorado. So this is a very wordy slide, I apologize, but in terms of provider qualifications, there's just a few things I wanted to highlight. The first is in terms of staff qualifications. So I know we've had some questions in past meetings about training and things like that. So as sort of a baseline, we're mirroring this to supported community connections with some additional training or need for additional skills related to fading, building natural supports, and meeting workplace expectations. We're not envisioning or expecting that this would be anything like the intensity of training that we require for job coaches, like no ACRE certification, things like that. But we do think it's important to provide staff who would be providing this service with some additional support around how to engage and interact in someone's place of employment, because that can be really different, right, than if you're used to sort of providing a service at day program or even out in the community, like sort of a general community outing is different than work. And in addition, sort of how and why they can provide support in a way that allows for fading and how to go about fostering natural supports. So a few other things to note, if someone is authorized for both workplace assistance and job coaching, like I was mentioning earlier, those services could be provided by the same provider or agency or by different providers or agencies. And then finally, that in this case, sort of different than benefits planning, the individual providing the service could be a relative or a legal guardian, but cannot be a legally responsible person. Should be like a parent or a child's guardian. Okay, moving along. One thing we want to spend some additional time on that I know we've talked about just a bit in earlier meetings is the philosophy we're hoping will guide this service and the sort of tricky line we're trying to walk offering it. On the one hand, we know the service is needed, right, to make sure everyone has the opportunity to work. But that said, we also know that having a paid staff person sort of watching over you can accentuate someone's differentness or disability. And so because of that tension, we want to put processes in place to encourage best practices and encourage people to sort of think critically about whether this service really is needed and examine when and how the service can be faded. Recognizing, of course, that everyone is unique, everyone's situation and needs are unique and different, and that what fading looks like and whether it's possible might be very, very different from one case to another. And this guy making his eyebrow raise, this is our member being like, why are you hanging out at my job with me? Leave me alone. So this ties into another concept that we want folks sort of either accessing the service or authorizing the service to be thinking about. And that is that a member's supervision needs at work could be different than in other settings, especially over time. I think in general, we tend to sort of like lump work in with the community when we're thinking about safety concerns and things like that. But the natural supports available at a work site, such as the member's coworkers, may be more involved and engaged than those in other community settings, right? Like your coworker is different than like the barista you see when you get coffee every day or whatever. And so those folks will have regular opportunities to get to know, interact with, and support the member that's working with them. So as we're thinking about supervision levels in general, remember that work settings can and often should be treated differently than other settings. And finally, especially when we think about safety concerns, having a really solid, appropriate job match can control for a lot of concerns that members and their teams might have about work. So given all that, we want to make sure that the presence of a paid caregiver and therefore the use of workplace assistance is based on actual need. So as with all services, but especially for this one, how often and how long the service is provided should be determined through a person-centered process. And that process should aim to promote integration and independence at work as much as possible. So as part of this service, we plan to require that teams evaluate the members' actual worksite support needs no less than every 6 months. So as we were sort of talking about earlier, for those who have a rights restriction, this process could occur sort of as part of that rights modification review, which should already be taking place at that frequency. But even if someone doesn't have that modification, they're not going to have the whole HRC process, but we do still want to see the team coming together at least twice a year to evaluate what are the needs, how is it going, how is it working. And then as part of these reviews, we think that fading should be discussed and promoted. And again, I want to sort of like asterisk, right? Like we recognize fading may not always be possible. So for example, if there's a court order involved, like it's a court order, that's what it is, right? But in many cases, the level of workplace assistance could potentially be reduced over time or maybe even fade out completely. And when we're thinking about fading and sort of the need for this service in general, some things to consider include the nature of the job, the work locations, longevity in the job or sort of continuity there, likelihood of harm to the member or to others. And again, in particular, some of these things can be controlled for with job match. So before we open it up to sort of the broader conversation, one thing I would love some feedback on is, like we recognize having sort of a robust conversation about the need for this support and fading and job match and things like that could be challenging for teams if they don't have someone on the team who's really familiar with supported employment or employment first. And so we've been sort of grappling with, okay, if we're going to tell people we want them to do reviews, how do we make sure that they have like the information and the tools to do that effectively? So we've been considering something like strongly recommending that the team include someone with an ACRE certification, or requiring that the member be offered to be connected with an advocate if they don't have a job coach or someone else with sort of relevant knowledge and experience on their team. And so I'm curious if you all have any thoughts or feedback on that concept specifically, and anything that comes to mind for you when you think about like the ability and sort of resources that a team might have or need to be able to effectively assess whether the service is needed and how it could be faded. I'm going to click on the chat while we wait. Let's see here. Oh, this is a lot of scrolling up. Okay, hold on, sorry. Yeah, so I see the comment from Ann Patton about why the assistant position would be billed at a lesser amount than the job coach when they're responsible for different kinds of support. Totally get that, and totally agree that we are sort of asking for this person to have some additional skills and training. A couple of things. One is that we're sort of intentionally not requiring the same level of training as a job coach. We don't anticipate that people providing workplace assistant service would work with quite as many different clients. And sort of a key part of the legislation is that we're directed to create a service that would be less intense and less expensive than job coaching. And so we're trying to sort of strike a balance between how do we set some reasonable expectations for what skills we would want someone to have in this position, while also not making the requirements so stringent that it becomes sort of unrealistic for it to be a different rate than job coaching. Because right now, you technically can use job coaching to provide line of sight supervision, for example. I realize that doesn't entirely answer your question, but, or it's not even a question, I guess, exactly. It doesn't entirely address the feedback, but I guess what I would say is if there are thoughts about like ways that we could be more flexible, or recommendations you have around like what we should or shouldn't require of someone providing the service, that's definitely helpful. Yeah, sort of similar from Rochelle. Okay, and then from Sarah, will there be a separate line for employment supervision levels in the IP? This way it won't need to be grouped with community. Great question. I would love to see that. I would put that in the category of things we're working on with our friends in case management. I do think even if it is not on its own line, I believe there's still a way to sort of like indicate that there can be a different supervision level at work versus in the community. But I might be wrong about that because I'm not good at IP stuff. So Jenny, feel free to be like, wrong, Kim.
What I can say is I don't know what it will look like in the new service plan. So I think it's definitely a question we can investigate to see how they have it broken out. I know at the community center board that I worked with within like the 100.2 and within the service plan, in some of the narrative spaces, we would literally write out, this is what it is in the community, this is what it is at home, this is what it is overnight. And then we had a separate one that we asked our case managers to say kind of in a vocational or work setting. So definitely appreciate the question and the point, and we'll see if we can get that to be a little bit more straightforward in terms of where people capture that, because we are pushing into that space of wanting people to think differently about work settings. And I think having a space to capture that, or to prompt teams to have a conversation about it that's different than like the day program setting, would be really powerful. So thank you.
All right. I bumped us forward to sort of the more general discussion about this service. I wasn't hearing a ton of feedback around the sort of specific question around like, should we put some parameters in place around who should be part of the decision-making process? So just sort of in general, like, are there questions, feedback, additional concerns? We've got just about 10 minutes left, I think. Kendra, I see your hand up.
Hi, sorry. Hi, everybody. Sorry, I was unable to attend the other two meetings of this
No worries.
genre. And I have just kind of a clarifying question, because
Yeah,
I'm an employment specialist, but I also have a really heavy background and still provide services for the IDD community. I'm not really seeing a lot of difference necessarily between job coaching and the workplace assistance, other than it's almost like workplace assistance adds a little bit of that mentorship aspect that you don't necessarily get with job coaching. Are you able to give me a little bit more explanation or help me understand a little better as to the differences between the two?
yeah. So great question. I think there are some similarities, right? Like the sort of fostering natural supports in particular is something that I typically would think of as the responsibility of a job coach or an employment specialist, but can also be, we're envisioning at least, can also be a big part of the workplace assistance service. I think the things that I would associate with job coaching that sort of aren't represented here. And actually, I'm sitting here wondering, like, I wonder how quickly I could find the slide from the last presentation. But we did sort of maybe Katie, you can get a link to the slides from our website and we can put it in the chat. But we did sort of a side-by-side last time of like, here are some things that are very clearly job coaching and not workplace assistance. Here are some things that are workplace assistance, but kind of not really job coaching, and what goes in the middle. But I would say like things like developing tools and resources to support an individual with learning skills on the job, or supporting with the sort of orientation and training, or helping navigate, conflict or challenges with a supervisor, or anything that's sort of the more like hard job skills, I guess, is what I think of as being job coaching, employment specialist realm, as opposed to workplace assistant. Because the intention, I would say, is that if someone needs workplace assistance, which most people will not and wouldn't qualify, then that service is sort of backfilling as job coaching is faded. So someone might become increasingly independent, and should and would become increasingly independent in their job tasks, right? And the sort of ins and outs of their job. And they may require some ongoing job coaching at some level. But if they have a rights restriction and need line of sight supervision, we wouldn't want to have a job coach have to be there all the time when they don't actually need coaching with their job. And then at the same time, we don't want that person just sort of standing there supervising, right? Because that's weird. So that's where this sort of like gray area overlap has come in, where like, what are the things that, yes, like a job coach can also do, but could be the purview of a workplace assistant. So I hope that answers your questions. Hopefully Katie can find, if you didn't already, can find that link. If not, then when we're wrapping up, I can grab that. Okay, I see Heather with a hand up, and I also see the chat, which I should open.
I was just just wondering if you have any idea of when we might know what the benefits counseling or the reimbursement rates are going to be.
Yes, you have previewed my next slide, so I will back to that momentarily. I got a thank you from, all right, I see Katie's got the things in the chat. So if you want to access that previous slide decks, those are there. Okay, Sarah, from a provider perspective, right now it's been working well to build individual job coaching when someone needs a level of support at work that would make them eligible for workplace assistance. Why was it decided to create workplace assistance instead of just absorbing that into the role of a job coach? I was not here when sort of the policy discussions were happening, but what I can say is because the legislature told us to, at this point, the bill directs us to create that service. My assumption would be that the intention was to expand services without increasing costs, but I can't say that for sure. I'm not sure. I wasn't here for the dialogue, but at this point in time, the bill passed that says create workplace assistance. And I think for what it's worth, the dialogue around workplace assistance and standing it up as a service, I think has raised awareness for folks that people who have line of sight or who have more sort of intensive support needs like can actually work and can access the staff support that they need and still go to work. So recognizing that for providers that were sort of already using job coaching for that purpose, that creates some challenges. It also hopefully will open up work to a lot more folks. Heather, see a hand up. Sorry, I half called on you before and got distracted, I think.
Sorry, I just forgot to lower it.
Oh, okay.
Great. No worries.
Pat myself on the back for my efficient question answering.
Hey, Kim, can I just mention real quick too, on that webpage where we have our recorded slides and the slide decks, there's also the legislation that's been happening throughout Employment First, in case you're curious and want to take a look.
Oh, cool. Yeah. Just some quick legislative reading. Okay, I have a poll, but I'm gonna launch it super quick and then move on because I want to make sure I talk about the rate stuff. This is our, did you remember or did you forget that we said maybe workplace assistance is not the right name? So this came up in the last stakeholder meeting and we tried to think of other ideas. And the only other idea that we came up with is potentially workplace support instead of workplace assistance. So the poll question is, what are your thoughts on a different name? Is workplace assistance best? Would workplace support be better? Doesn't really matter. Or maybe you have another idea. If so, thank goodness, because we sure didn't. Please specify that in the chat. And then while y'all are answering that, I'm just gonna hop forward because we're coming up on time. So super quick, another piece of this legislation is the buy-in for the developmental disabilities waiver, and that will be available in place happening January 1. And then the other sort of major piece of this legislation was moving all supported employment services, including these new services, outside of the service plan authorization limit, or the SPAL, in the SLS waiver, and that will be effective July 1, 2023. Someone said they have another idea. I'm watching for the chat. I see. Okay, so next steps, this is where we get into the rates piece. So on our side, obviously, we'll continue to sort of refine service definitions in conjunction with our internal teams and sort of get into the phase of submitting to CMS for the waiver amendment, developing the rules for the rulemaking process. Rule updates will be through the Medical Services Board, which you can also follow along with. Rates development is going to be sort of taking place over the next month or so. We had been hoping to schedule a rates specific stakeholder meeting, but because we're on such a tight timeline to try and get these launched in time for July, What we're going to do instead is the rates team has some specific information that they are hoping to get feedback on from providers about what it would take to deliver these services. And so we're going to put together a provider targeted survey and then try to blast that out and get people's feedback that way, to make sure that we're not missing anything in the rate development process. And then in terms of when the rates would actually be announced, that I do not have a super clear idea about, but my guess would be sometime probably in the spring. And then from there, once we're sort of launching all of this into the ether and waiting for our federal friends, we will be sort of shifting internally with our team to focus on training, technical assistance, promotional material, to get the word out about the new services and how to access them and things like that. I'm gonna end my poll. What's my next slide? Contact. Okay, so here's the poll. We either don't think it matters or we like workplace support, but some people like workplace assistance, and someone had another idea. Where's the chat? Facilitator support may do it better. We talked about workplace facilitator. I don't know. Okay, workplace assistant or support. Okay, all right. Easier connection to the usage of work incentives. I see. Oh yeah, cool. Okay, great point, Melanie. Thank you. So essentially, if I'm reading this right, oh, Jenny already said, great insight, Melanie. Okay, great. Thank you for your feedback on the name. Contact info. This is my contact information and Jenny's. Please reach out if you have questions, feedback. You're sort of ruminating on this and you're like, what did that girl say? What was she talking about? Feel free to reach out. And watch for future announcements. Watch for provider survey if you're a provider. And again, like, especially as this is our third meeting, I just want to really, really wholeheartedly thank you all for your engagement and your participation and your feedback. It's been really, really helpful. I see Jenny nodding along, and Jenny, feel free to add anything if you have it, but otherwise just thank you, thank you, thank you. And we've got a minute or so for questions if anybody has any lingering questions.
I just want to echo the thank yous. And also, if you felt like you've got a burning question or a big idea, please do reach out, especially those of you who were kind of like, I think you're missing it with that safety piece. Would love to have some insights from you in terms of who do you think we would not be capturing with this. I do think a lot of it will come down to how we define safety concerns. So having some examples will help us in defining that, and we might be able to reach those people that you don't, at face value, don't think that this might be reaching. So again, please send us your ideas. You can direct those to me, jenny.jordan@stateco.us.
All right, we're at time. Thank you so much, everyone. Enjoy the rest of your day and the weekend, and appreciate you all being here.